One of the roles of this podcast is to empower you, the listeners, with information and knowledge which might open up the possibilities that are available to us when it comes to our health, both physical and mental. This week's guest promises to share valuable insights and exciting research for understanding anxiety, addiction, and trauma, and offers a proven method to improve well-being. We're welcoming Dr. Frederick Schiffer, a sought-after speaker, best-selling author, psychiatrist, and part-time assistant professor at Harvard. Dr. Schiffer has a wealth of experience in psychiatry and has been studying the relationship between past traumas, cerebral laterality, and depression and anxiety. He has tremendous knowledge of dual brain psychology techniques, which is what we'll be hearing about today. And as Dr. Schiffer just said to me before we started recording, it's kind of a little bit like, what did you refer to it as? Offbeat.
It's offbeat. Yeah, it's not the
It's not
usual.
the usual thing. So
Yeah.
which is what I love. So welcome. Thank you so much for joining us. I'm really looking forward to our conversation and hearing all about what you're doing in the world of psychology.
Well,
Do you
thank
want
you.
to tell us a brief history of Dr. Shiva? Can I call you Fred?
Absolutely. Yeah.
We'll call you Fred from now on. So a brief history of how you got to where you are today with the work that you're doing.
Well, that's maybe a long story,
A
or
long
maybe
story. Okay, let's try and do the abridged.
I'll try and compress it. Um, I started as a Freudian psychiatrist. I wasn't an analyst, but I was of that ilk of talking and trying to understand the unconscious and sort of in-depth psychology. And and I noticed that wasn't really seeing superegos in my office clearly, or but what I was seeing was two minds that people seem to have, and that one mind was sort of like an id. It was regressed and primitive and impulsive and had made bad choices. And this really very much is like the Freudian id, except that the Freudian id is supposedly unconscious, and the ego, rides on it and tries to restrain it, and uh, and what I came to find is that in each brain hemisphere there's a different mind, and one of them is this neurotic id-like mind, and the other is pretty healthy. It's more like an ego, and that they can dominate each other. And so somebody can go through life with their id-like mind dominating and leading to depression and anxiety and addiction, or all of the uh, 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 psychological problems that we're familiar with. And um, and so what I've found is that it's easy to stimulate one brain hemisphere or the other, and you can get a different person depending on how you're stimulating. And that the eyes are connected to the brain in an interesting way. So that something that's shown over here to not sure my coming. Okay, so something's shown to the left lateral visual field. It's only seen in my right brain initially, and something shown to my right side is only seen by my left brain initially. And so I discovered that if I covered one eye and the middle of the other eye, I'm looking out a lateral visual field that by the connections between the eyes and the brain hemispheres would stimulate the opposite brain, which in this case would be my right brain if I went like this. And and conversely, if I go like this, I'm going to stimulate my right brain. So the first time I tried it, I was following a German scientist who had a very complicated $1 million machine. And so I figured I could do the same thing with my hands. And I didn't respond to it initially. Later I did, and I still do. It's interesting. Um, but for years I didn't. But I went to the office and I asked my first patient to try it, and he was a Vietnam veteran who had 4 tours of duty, had a Purple Heart, and came to me for combat PTSD, and he was doing quite well. But I asked him to just put his hands up, and he was looking out his right visual field, which would stimulate his left brain, which we commonly think of as the good brain. But it turns out that he got very upset. And he said, that plant behind you looks like the jungle. And I knew he was having a flashback. So I quickly said, well, look out the other side, and had him cover this eye and look out here. No, I got it backwards. So he looks like this, and he says, and he smiles, his whole demeanor changes, and he says, no, that's a nice looking plant. And I repeated this many times that first day, and have for decades. About 55% of patients in my practice have extreme responses like this Vietnam veteran. So it's not like a rare phenomenon. And about 15% don't respond at all. They may later, like me, respond. And about 30% will have a difference, but on a 10-point scale, it's like a 2-point difference or a 3-point difference, which is enough to work with the person on. And so the idea of dual brain psychology is that we've got 2 minds in each of us, and that I actually can talk to 2 people in one person. And so I'll say, I want to talk to the little girl. So, hi, little girl. This is Dr. Schiffer, and I think that what happened to you when you were 4 years old is really, really sad, and I'm sorry to hear that. But you have to stop tormenting your other side. You've got to behave and work together, and then I'll talk to the other side, and I'll say, now listen, you have to be a little firmer with her, like a good parent, and you have to tell her to stop torturing you, and sometimes you have to say, now get in the back, just like you'd say to your child. You're not hurting them, but you're using some discipline. No, you can't write on the walls, so what I'm doing is treating the injured, traumatized mind that happens to be more immature, more childlike. And you could call it the inner child, but I don't like that, because inner child is so overused, and where I'm really talking about somebody. I can talk to them, and the patient will say to me, "Oh, she heard you, and oh, she feels better now, or she's angry with you, or whatever, And so and sometimes it'll be the person talking to me, and person might say, you look angry with me, and I don't feel angry, and we sort of follow that feeling, and we might trace it back to their mother who was angry and who was traumatizing. And that brings us to another point that when I talk about trauma, I talk about it in a very wide breadth. So it's anything that hurts us or harms us or deviates our performance. So if our parents are fighting and it upsets us, and we go to school the next day and we can't pay attention, that then becomes a trauma. And if we don't do well in school, then the teacher gets angry with us and gives us poor grades, and we don't go on to the next level, and then we get in with other people who are having problems, and they're using drugs and they're smoking dope or drinking, but generally the immature minds usually don't think of great solutions. Occasionally they'll wind up at the library, or somebody will take an interest in them and steer them in a positive direction. But usually, the solutions that the immature mind selects are childish, and their intention is good. And Freud came up with a term that he observed, and he called it the repetition compulsion. And what he was observing was that his patients were repeating their trauma and setting up circumstances in which the same trauma was going to be repeated.
Mm-hmm.
And from the child's perspective, um, uh, they're sort of like a boxer who got knocked down. And he says, "Where is he? I want him. I want another shot at him." And they want another try with the trauma, and they'll conquer it this time. And of course they don't, and because they're children. The other thing that's interesting is that the immature mind thinks like a child, and children overgeneralize, and and uh, and and they have a certainty, the boogeyman's coming, and you can't talk them out of that easily. And so when I treat somebody, I have to be like a parent and be patient. Just so it actually is just like being a parent, but I'm also teaching the person why they're in pain, and that when their parents fought, it was unbearable, and they really screamed at each other. I'm thinking of a patient I saw yesterday, and and he was a new patient. I was trying to feel around where the trauma was, and he was addicted to fentanyl, which is a deadly drug, um, and and he had no idea why he was addicted, except that he was an addict. And what we learned was that he was using fentanyl as a medicine for the pain of his trauma, which was not just his parents fighting, but that's what led to the school problems, and then the whole cascade of bad decisions, and then he becomes an addict, and then an addict is very traumatizing once you're called that, and it's humiliating, and we're as human beings, we're very sensitive to appreciation and very sensitive to disrespect, and most of the traumas have something to do with disrespect, and whether it's bullying, which is an overpowering, or sexual abuse, or that um, it, it often becomes something that is injurious to our self-esteem, and that's very painful. That's where a lot of the great pain comes from. And then there's a lot of anxiety. depending on the type of trauma.
You've given us a
And
few topic points.
yeah, yeah. And
um,
the question is the same thing. These are all normal feelings.
mm,
Uh, and if I were in Gaza uh, now, if I weren't depressed, I wouldn't be normal.
mm,
Uh,
yeah,
and
right.
if I weren't having anxiety attacks, I wouldn't be normal. Uh, and and the people who come to see me are suffering from a cause. And when you get to depression, there's a sense of defeat.
Mm.
Anxiety is the sense that there's impending danger. And if that danger comes and it defeats you, then you get depressed.
With your thank you for that amazing introduction. And I was like, had these little questions popping up, and I'm like, oh, I hope I remember everything. I didn't want to look away to write them down. So one thing I would love for you to determine, like there's a whole bunch of things that I would love to hear more about, but one thing I'd love for you to determine is like when you talk about depression and anxiety, there seem to be so many like such a wide realm of what that can mean. Like you can have someone who's anxious about a certain just doing a certain thing one day, and then there's people that like are afraid to leave their house, right? And it's just like, is it a build up? Does your treatment work in the same way for everyone, or are there certain types of depression and anxiety, like bipolar compared to any other? Like, are they all the same? Is everything the same, or is it
In my view, it's all the same.
okay?
And there may be exceptions. I don't see the whole world, but
Yes.
in what I see, it's all the same. And and that what if you drill down why the person's anxious, then you come to an answer. And and one patient uh, had agoraphobia,
Right.
so she couldn't leave her house, and she needed to be accompanied by someone to come to my office, and and she just had agoraphobia. That was the explanation, and and it turned out that her grandmother, for reasons of her trauma, which we don't have access to, and she's no longer alive. Um, uh, uh, would say to her as a small child, "Come right home because men can abduct you." And they lived in Newton, Massachusetts, where my office is, and it's a very subdued, safe, suburban Boston suburb, very affluent, uh, and uh, and her mother's concern was not realistic, but her grandmother rather, but her grandmother uh, 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 was persistent in every day. Oh my God, did you come straight home, and are you safe? So she developed a terror of being abducted, and her mother, who was also traumatized by the mother, uh, had her abducted when she was 15 to go to some kind of camp to deprogram you and cure your anxiety. And so they actually put her in handcuffs and and
Oh my
and
goodness.
had no idea who they were or where they were taking her. And so there are real reasons for her agoraphobia. So to just say, well, she's got agoraphobia, it was inadequate and incomplete.
Mm. Wow. Wow. I mean, for that, when you tell that story, it's like, well, that's pretty obvious, isn't it? That that's going to cause some kind of trauma. Um,
No
does
clue
it
about.
seem to come out of like? Does it seemingly, for some people, come out of nowhere, or is it something that builds over time? So, because when we're talking about, something that you may have experienced when you were 4 or 5 years old, for example, or something that you held on to from an experience, but then it doesn't present until you're in your adulthood. Is it because of something that's happened that's triggered it, or is it a gradual build-up of experiences over time, like
More
that
of a,
affirm that belief?
yeah, I think it's more of a buildup,
Mm,
uh, and that that if you look before the breakdown, that uh, that there were feelings of insecurity,
mm,
and that they were sort of vague, and then there weren't enough to sort of call medical attention to.
mm,
I think that that there's a buildup, and then I think most often people kind of have uh, a, a breakdown of sorts uh, um, in their late adolescence, early adulthood,
mm.
because that's a real challenge. That now you have to kind of leave the nest and go out on your own and see how you're going to do in the world. And
Right.
if you don't have the right training, and your wings aren't, muscles aren't all developed, uh, uh, you're not going to be able to fly, and then that becomes terrifying. And so that's why a lot of college students flunk out and have breakdowns early, and why a lot of people turn to alcohol
Mm,
late in high school, and then that turns into hard drug use. And
yeah.
so they're common forms of psychiatric issues, uh, uh, and the person who is depressed might have, it started earlier, when they felt left out, and had a sense of hopelessness, and a sense that they were inadequate.
Mm,
And I think that the idea of bipolar is uh, a problem, because you have someone who's been suffering a sense of inadequacy, and you tell them, well, actually, you really are inadequate, and in fact, you're genetically inadequate, and there's nothing you can do about it except you can take these 6 medicines and be half normal.
mm,
And I don't think bipolar is any different from any of these other things. In other words, that the symptoms that one develops are somewhat different. They're all similar in that they're painful. They're uh, they're all things that we would normally feel in Gaza, uh, and and the problem with Gaza is that it's actually happening. So it's
mm,
not PTSD, it's not past trauma, it's present trauma. And so that you need a political solution, or an army, or some actual solution. Whereas a woman who is has post-traumatic stress, she needs to be taught that she's not in danger walking down the street, or the Vietnam vet, that he has to learn that he's not in danger, he's not in the war zone anymore.
yeah. Wow. It's pretty. There. I guess there are so many levels and realms of like what's going on, isn't there? Because when someone's experiencing something right now, like you've referenced the war in Gaza, there's also that kind of need to kind of put the hard exterior on in order to have like as a coping mechanism to being in
Right.
one of those
Sure.
in that kind of environment. And
Right.
so like you almost don't allow yourself to have the experience because like it could be pretty intense. So, and I guess people who have post-traumatic stress, that's what's going on, right? It's like all of that build up where they've had to
Yeah. Well,
just kind of put the blinkers on and
yeah, I think what you're describing is, in other words, initially, like with this woman who had agoraphobia, the little girl in her was dominating.
mm,
And so in her life, the world looked dangerous, and that abductions, even though she wasn't consciously thinking of abductions, there was danger all around, and that her little girl was dominating. You're describing someone whose adult side is dominating
mm,
and suppressing the child. So the
right,
child is probably screaming, get me the hell out of here. Uh, and and the adult has to kind of keep the lid on
right, yeah,
and as a doctor, sometimes you have to do that. That if you have someone who's suffering cancer, or if you're a surgeon and you're operating, you have to have a separation and be able to
mm,
cope.
yeah. So I think it's really important that you've expressed that all traumas are relevant to someone's experience, right? It doesn't matter if it's not being in a war zone or like have being in real danger, but if for any reason someone in their younger years has experienced something that's made them feel what unsafe or
Yeah, and
less
also
than.
it's often covert. In other words, it's seen as normal.
Yeah.
It could be sexual abuse, can be
Okay.
seen normal, and but it could be like a father's ridicule,
Mm,
and that's well, I deserved it. I didn't say something clever, and so the child always blames themselves. And if the parents get divorced, the child thinks that I caused the divorce, and the children always see themselves as the cause for any problem, and there's a reason for that. That one of that if they're not the cause, then it's hopeless. If they're the cause, they can become a good boy or a good girl
okay.
and solve the problem.
Yeah. Yeah. And so it's kind of important for all of us, isn't it?
Yeah, yeah.
Oh, to have that sort of healing. When did you At what point did you come to that kind of conclusion where it wasn't just, your army veteran, but that you saw these kind of like smaller inadequacies that people were feeling playing out and like and how relevant that was to the type of work that you do in someone getting better.
Well, I sort of came out of a Freudian
Yeah.
uh, atmospheres, and that's so it's not that different
Mm,
from analysis, except that it has a different concept. So that rather than being an amorphous id that you can't find, it's actually something that we've done fMRI studies at McLean Hospital, which is the flagship mental hospital for Harvard, uh, where it measures the activity in the brain. And if you look to the left visual field, your right hemisphere actually lights up. And if you look the other way, the other hemisphere lights up, and this is, so we have, we've done a number of very high tech studies. So this, in fact, this is the first theory that's come out of science that's based on hardcore science. Uh, uh, there were the split brain studies in the 1960s that won the
Yeah.
Nobel, and 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 so this is related to my work, and 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 we have about 30 publications from McLean and other sites where we've tested this hypothesis and with high tech equipment like EEGs and fancy equipment, and we always get great results.
Yeah, it's amazing. That I was reading your book, the one not you haven't I haven't got my hands on the one of Two Minds.
Yeah, two minds, right?
Yeah,
That's
and I was reading about the split brain
yeah, right. Yeah,
studies. Well, that's pretty intense, isn't it? Do they still do that? I
yeah.
mean, they don't do that
Uh,
anymore.
well, they do mini
Okay,
ones. They
yeah.
make it more
But it's
complicated.
amazing that your work kind of came out of that and your interest and fascination with the two parts of the brain and how they can behave quite differently. Um, oh, I can't remember what I was going to say. Yeah, that just blew me away. Um, you mentioned we can talk more about what it is that you actually do, and then you've written a new book that's due to be released. So I'd love to hear a bit about that. But the actual process of the split brain psychology. So you've kind of given us a bit of a pretty, solid intro and a bit of information about like why people might need this and what's going on when someone's traumatized or when they've got an addiction or if they're depressed or anxious. That there's these two hemispheres of the brain that aren't working coherently, I guess, right? One's dominating. So, what does you also mentioned? Sorry, just go one step back. You also mentioned that it didn't work on you, so you've tried
Hmm.
it out. But now you find that it does. What does it actually look like? Do you because in your book you talk about like having goggles. I haven't read the full book yet, so like I feel like there's probably like I'm missing a step. But when I was reading, you had the blockage of the
Yeah, actually,
sight
you
and
have
just
an
peripheral.
did you have an envelope handy, like a
An
letter envelope?
envelope. Oh,
Yeah.
possibly. Yes, I
Let
do.
me get one. See if I can get one myself.
For those
I'm going
not
to use an iPhone.
okay.
I'm going to. So I want you to cover
Oh,
your
cool.
right in the middle of your left eye. There you go.
So like this,
Okay.
yep,
Yep, just like that.
yep,
Okay. Now, I want you to think of something upsetting. So it doesn't have to be, the most upsetting thing that you've come across, but it's something that would upset you generally,
yep.
and and make a note from 0 to 10
Mm,
how stressed you feel. Okay,
yep.
you can keep it to yourself,
Okay.
and then you need to switch and cover your left eye in the middle of your right eye. And I want you to think of the same thing that uh, that you were thinking of. And if anybody's watching, they could try this as well.
Yeah, so we've just covered up most for the listeners. You can come over to YouTube and watch the video of this because it will be audio and video, and do the envelope test.
Now, did
Okay.
you feel a difference or not?
A little bit, yeah. I probably wasn't specific enough about about something that I was emotional about, I think. But there was definitely on the first side, it was like nothing. Like completely nothing, no emotion. And on the other side, it was like a little bit aggravated, but not too bad.
Wow.
Yeah, but definitely like just like that kind of feeling on the first side.
Uh,
Yeah,
uh,
nothing. It was, yeah, it was like I was surprised because when I have both my eyes open and I think about it, it does aggravate me.
right.
Yeah, yeah,
Uh, and so it's important in my work, to talk with both sides,
yeah.
and to talk to the more troubled side, and get to know it, and help it, and let it know that um, that I want to help it. And one of probably the greatest problem in helping someone is that the troubled side doesn't want to give up authority and power, and
Mm,
saying, so you want this other guy who I don't know to run the show, and I've been running this for 30 years, and you want me to go on disability? Well, the hell with you. So there's a lot of what we would have called resistance, where the
mm,
troubled side doesn't want to change. And so it's a matter of talking with it, and explaining that you're actually in a lot of pain, and you're risky, you're taking risks, and or you're wind up in these relationships that always wind up very painful, so whatever the problem is, and so it's sort of a negotiation,
mm.
and so I uh, most of my energy, I think, is in trying to convince the troubled side to cooperate a bit, and take a chance, and sometimes I'll say, why don't you look out the other side? And I don't know what I'm doing, as I don't know what that all means, but the person will say, oh yeah, yeah, I feel that feels better, uh, and now one thing that we're doing that's interesting is I wanted a way to stimulate the brain more powerfully than with the vision. So we developed a special LED at MGH, at Mass General Hospital, and um, and we put that over the positive hemisphere. And right now we're doing a very large NIH study. That's the National Institute of Health, and the National Institute for Drug Abuse. And we have an FDA breakthrough designation. And this is our second trial. So we got very good results in the first trial. And what we're doing is we're putting this LED over one side of the forehead or the other, depending on the glasses. Uh,
Okay.
uh, and I don't know who's getting active and who's getting sham, but half the people are doing remarkably well, and half
Okay.
aren't.
Okay.
Uh, so
So is that like
it's a clinical trial.
yeah, okay. So you're not allowed to know who's doing what.
That's right.
Yeah.
Yeah, yeah. A double-blind study, so the
Okay. Yeah.
patient doesn't know, and only the person who administers the treatment knows, and he has a secret way of getting the information about
Yeah.
which side to.
So when you have someone that you're working with face to face at the moment, do you use the goggles that you
Oh, yeah, yeah.
yeah. And are they a
Or
special are they like did
I
you
don't.
originally made your own
Yeah, I'll use an envelope or an
oh you do.
iPhone,
Okay.
and I have sunglasses that uh, have an open area on one side,
Yep.
and they work just as well as the envelope,
Mm.
and people like them because they can wear them, and some people like who are investors within the stock market, they won't invest unless they have their glasses on. I had one
So
patient.
do people do you sell the glasses, or do people make their own?
Uh,
Or
okay, so the sunglasses are discussed in my new book,
aha.
uh, and and we're actually not going to sell those because we have to go through an FDA
Mm,
process. It's very millions of dollars and 5 years. Um, but we're going to sell uh, Dr. Schiffer's stress reducing sunglasses,
oh,
and
cool.
and they're sunglasses that look appealing, and that nobody knows that you're wearing special glasses, so they're different, and they're more for just reducing stress than
Yeah,
treating an illness.
sure. Um, Before we talk about your book, could you tell me? Oh, so when I had my slight aggravation on the second side, that would that be the unhealed, or the younger, the child? Yeah.
Yeah, I think if we dug into it,
Mm,
if you weren't working, it's the same, and you'll do this on your own,
mm,
and you'll see, and then you
yeah.
can talk and see where it takes you.
So
Uh,
could you potentially do that with any kind of issues that are coming up? Like, does it have to be specifically? I mean, most issues are probably based on some kind of past experience or trauma, aren't they? Like when we can't get past an obstacle in our lives for some reason or other.
so yeah, yeah,
Yeah.
and I think the idea is to see what you're feeling
Mm,
and just follow the feelings. So it's sort of like following the breadcrumbs.
yeah. Okay. Cool. Yeah, that's really interesting. And before we do talk about your book, excuse me, the studies that you're doing at the moment with the light,
Yeah.
how would that, if you're using the glasses in your own practice, how will the light therapy potentially work and be rolled out into your practice?
My practice in studies. So I get IRB approval. IRB is the institutional review board. So they see studies and make sure they're safe, and you have to report to them. And so it's not FDA approved,
Mm,
but I can do studies with it. And
okay.
so I'm doing FDA study, and I also can do studies in my practice as long as I have an IRB. And so I use the light in my practice,
Okay.
and it's quite remarkable. Uh, and one patient came in and he wanted to gamble, and he actually was being treated for drug abuse. But again, this was like a new issue, and he said he really wanted to gamble, uh, so I said, well, fortunately, I've got a casino in the back, but unfortunately, there's a cover charge, and so we had an auction, and he was willing to pay $2,000 in for the cover fee to go to my casino. So uh, and I said, we extend credit, and he laughed. He said, "That's a bad idea," and so I gave him a 4-minute light treatment, and and I said, "So you want to pay to go back to my casino?" And he said, "No." And I said, "What do you mean?" He said, "I don't go back there." And I said, "You're not going to pay me anything?" and and he never did gamble. I've discharged him years ago, about 5 years ago, and but in the 2 years that he remained in my practice after that, gambling never came up as an issue.
Wow.
I don't. I'm not claiming that this is a permanent cure for gambling, but in this one case, I don't see a lot of gambling. But um, um, and I've had patients. I like auctions. A patient with came for alcoholism, and he wasn't drinking at the time. But I said, if I happen to have a beer in my refrigerator, we had an auction. I got $500 for the beer, and so I treated him. And again, he wouldn't pay me anything.
Well,
And said, well, I'll give it to you. And he wouldn't take it. And I didn't have a beer in my refrigerator, of course. And I think, he knew, I think both of those knew that, but it was a mind experiment and they took it seriously. So it has really powerful effects. My first experience with it was that my wife and I were on vacation in Italy. And so we were up all night on the plane, and I didn't sleep, and so we landed in Milan, and yeah, it took I don't know, a couple of hours to get the luggage and rent a
mm,
car, and then it was a 6-hour drive
ooh,
to a place that we rented. And my wife, very good driver, usually drives, and so she's driving, and about an hour goes by, and I notice that I feel like we're going to crash. And after about another hour, I notice that the highway is a normal highway. Okay, it's a divided highway. In fact, there was really just one direction. The other direction was in a separate place. And then later it dawned on me that maybe I should cover my eyes. This was about 5 years after I wrote my book, and
mhm,
and so I'm um, I go like this,
mm,
and all the anxiety is gone, as I could feel like it's this great change. So I look out the other side, and I get this boom of anxiety. And when we got to the place we were renting, I'm up on a balcony behind a fence, and there's a road there. And if I looked out my right eye, I felt very anxious, as if the cars could fly up and hit me. And out the other side, it looked like a normal road. And and uh, and I had to, I was like wrestling with myself, like Steve Martin and Lily Tomlin in the movie that they made. Uh, and I said, listen, I want to be sane or crazy. I want to enjoy the vacation or not. And I had to, kind of talk with myself. And of course, I had a lot of experience
mm.
and, and, uh, and, um, and I was able to calm down, and we had a good vacation. But uh, uh, and then years later, I realized, I didn't realize it at the time, but it had to do with a trauma that I had experienced, and that was that I had been bullied, and by someone who was sort of like a junkyard dog. And so they didn't hurt me so much as they scared me. And so in Italy, I was associating with the mafia.
Ah,
Uh, and now, my wife is Italian American, and we only met, lovely people, but um, but that was what my unconscious, or the little boy in me, made the association, and brought up this anxiety in me.
wow.
And actually, to this day, I use the light treatment for cognitive enhancement, and it actually, I think it's quite effective.
Great. That's amazing. Um, when someone does come to you for treatment or does this kind of practice, well, say they come to you and then they go away, does it only last for a period of time? Do they need to practice something on their own to like maintain, or is it like literally a healing process where they come to you for a period of time and you work through this relationship between the two parts of the brain, and then that's it, they're done.
Um, well, like any psychotherapy, that you have some successes
Mm.
and you have some failures. Usually the failures are people drop out,
Okay.
that they don't want to make the journey, and other people can take a long time. In other words, the negotiation, can
Mm.
negotiation. But I would say that the vast majority of people do well. But it's a therapy, so it isn't uh, uh, that come in, get a light treatment, your life has changed.
Yeah.
However, interestingly, in the study that we're doing, is for fentanyl. Now, fentanyl in the U.S. and probably in Australia too is like a blizzard,
Mm.
and uh, and people's lives get dedicated to it, and they spend their whole day, looking for fentanyl and losing fentanyl, and they can't work, and they're bankrupt, um, so these people are coming in and they're only getting the light treatment. There's no psychotherapy,
Okay.
and they're doing well. Or half of them, I say, half are getting a fake placebo, and they know that.
Okay.
I don't know which they're getting, but know that half aren't doing well and half are doing very well. And so probably, or I hope, people who are doing well because of the light treatment. So here, they're just getting a light treatment. There's no therapy, and they look better. Their lives are improved, and they feel better generally. So it's interesting. I didn't expect that. And these are fentanyl addicts. I mean, this is the most addicting substance so far.
Mm. Well,
And
that's pretty cool, isn't it? Like that you potentially have invented this amazing solution to addiction. Do you feel like you have?
well, we'll have to see what the results are.
Yeah.
They're about,
Yeah.
and McLean Hospital is doing half the study, and they're a little slower in the enrollment, and hopefully we'll have our full enrollment by this time next year,
Yeah. Wow.
and look at the results.
Cool. We're getting towards the end of our conversation, but I would love to hear about your new book, which is due for release in October, I believe, mid-October. Because as I mentioned at the beginning of the podcast, what I love is being able to, for the listeners, to know that there are possibilities out there for us to heal ourselves, and and there are so many different modalities that we can experience, try out. And your book is sounds like it's one of those things that if people are interested, or if they are experiencing trauma, anxiety, depression, that this is potentially a great solution to help them to manage that and to improve their well-being. So,
Well, thank you. The book is it's for people who are interested in how the mind works,
yeah.
how it really works, and that the important area of the brain isn't the amygdala or the hippocampus or the things that you read about. It's the hemisphere, and each hemisphere has a hippocampus and an amygdala,
Okay.
and and so those pieces are important, but the hemispheres are really important, and so people who are interested in how the brain actually works will be interested. There are case cases in which I'm meeting with the patient, and it's a therapy session, and it's narrative fiction, but it's based on reality. And so there's no identifying information, but it's and it's it's like a drama, so I've recreated it, but it's I think they're interesting and they're accurate, and you'll get to see sort of what I call dual brain psychotherapy is like, and then there is a self-help chapter. And by the way, when you're talking about like a simple thing to help somebody, if anybody in your audience has a cell phone, they
Uh-huh.
can use. So if you determine which side you feel better on, you can look out that side. And a lot of times, if you're feeling very anxious, you can go like this and cut your anxiety down significantly. And so there is a simple little thing that it's not therapy. It's but it can be. It's a tool, and my patients use that. The sunglasses are helpful, and they'll be available from a website
Yep.
when the book comes out. And
Great. And we'll share all of those links. So would you say if someone was experiencing anxiety in the moment, they're worried about something and they're getting themselves worked up, they do the cell phone or the envelope
yeah,
thing. Is it kind of like do that to work through it? Do you need to have the conversation with the two sides of the brain? Is it like as soon as you move the envelope again, it comes back? Or like, is there a process that
yeah. In order to do therapy and really resolve, get into, what the trauma was and help that part of you really heal.
yeah,
To to treat the trauma, you have to do therapy. Uh,
yes. Okay.
so it can be like taking a Klonopin, and there's a non-drug treatment that can really bring you down. Not everybody will respond to it, and I've
Mm.
never had a neurologist respond to it. Okay, whatever that monkey that their adult side is the dominant
Yeah.
side, move over. Um, but so not everybody's going to see a difference, or maybe like me, you won't see a difference right away, but
Mm.
maybe later. Uh, but a lot of people, the reason I wanted to try with it is that like chances are that you would respond, and and uh, and so I'm willing to take it, because if you don't respond at all, it looks, you know, and
Lucky you.
uh, and
Great.
so most people will probably feel a benefit
Yeah.
from just their iPhone.
Yeah. I'm definitely going to play around with it.
And it's not going to cure the
No,
trauma.
no,
That can be
but it will
quite
give
harmful.
you some kind of relief.
Yeah,
Yeah, in the moment. Great. And also some kind of awareness about what might be going on, right?
yeah,
Like
yeah.
when
And
you, because
you
I
are,
definitely, when I had the envelope on the first side, I was like, nothing. Like, what the hell? And then there was as I said, there was a bit more agitation. It probably wasn't like possibly wasn't a very strong emotion, but there was definitely a couldn't care less on the first side. So like being able to explore that like so simply and get a better understanding of what might be going on for you, definitely very valuable. What's your new book called? I don't have that written down.
it's called Goodbye Anxiety, Depression, Addiction, and PTSD.
Yeah,
The life-changing science of dual brain psychology.
cool. Wow. It's a pretty major title, isn't it? Um, to close, would you kind of give me a just where do you feel like you want this to go? Like, what's your motivation for this work in the world?
Well, I have a small ambition. Uh,
Yep.
Change the world. That I want to I want to see a new paradigm in
Mm,
psych. I want to see people appreciate what trauma is and how important it is, and stop traumatizing people with fake diagnoses and borderline personality. It's these are insults, and there's a joke. I don't know if it's time for a Borscht Belt joke. Uh, a guy goes to a psychiatrist, and the guy says, "What's my problem, doc?" And the psychiatrist says, "Well, you're crazy." And the patient gets upset, and he says, "I demand a second opinion." And the psychiatrist says, "Well, you're ugly." And,
love
and
it.
uh, and that's sort of what borderline personality or
Okay.
bipolar, or even anxiety disorder. They're disorders, and you're a disordered
Mm,
person. Or addiction is, I'm Fred. I'm an addict. I mean, it's really supposed to make me feel good, but it's really an insult.
mm, yeah. So, yeah. Well, that's a pretty good mission to have, I think, don't you? Yeah, and as I said, that's kind of part of my mission with this podcast is to empower people to better understand the possibilities that we actually have for our health, physical, mental, emotional, and that yeah, we don't necessarily have to do things the old way. There's lots more research that's showing that in fact there are some better ways to approach those things. So thank you so much for joining me today, Fred. It's been a pleasure to speak with you, and I wish you the best of luck with your book. We're going to share all of your information in the show notes and in our guest directory so people can access that and find all of the things that they need when if they want to find out more.
Thank
Thanks.
you. Thank
Thanks, Fred.
you.